Doctor, can you just explain the steps of this procedure?
Yeah, the treatment plan is depending upon each and every patient. So once the patient comes, we will study. We will take certain photographs. We have to take certain X-rays, and then we'll study about it for that particular patient, whether the patient is fit for this kind of treatment. Most of the malocclusion can be treated with this treatment, but then in certain cases, like when skeletal malocclusions are there, we can't treat it. So if a patient comes, we will study and we will get make a treatment plan for this patient, and then we will record these impressions, record measurements, and we will create a treatment plan with the lab, and so that the trays are fabricated. And also the advantage of this particular treatment is that even before the treatment starts, the patient and the doctor will get to know the outcome of the treatment. Depending upon the severity, the duration of treatment might be between 6 months to 2 years, depending upon the severity. So even before that also, we will get the result as an image, so that the patient will be happy how will the treatment go and how will the outcome will be. So that the only thing is that the patient should wear the aligners properly. The patient will receive instructions once the treatment is started, and if the consultation time, the consultation with the doctor is very less compared to the fixed. In fixed, we have to meet the doctor every month, but then in aligners the consultation time is very less. You have to go maybe in 2 months time or something, and if the patient is traveling itself, in the beginning itself the doctor will do the necessary, so that the patient will travel and the aligners are sent to the patient's address globally, wherever, and then the patient does not need any consultation with any other local doctors over there. The patient could wear the aligners as per instructions, and then the malocclusion will be corrected. In certain cases, braces are the only treatment which is possible, but then it's depending upon everybody's individual arrangement and things.
Another thing, doctor, in other types, like they do call up for tightening the braces, right? In this special method, do we have to change, in each visit, or is it the same that we are using?
The aligners, a aligner can't treat the malocclusion. A series of aligners will treat the malocclusion. Understood? So each aligner is prefabricated and pre-designed of that particular teeth movement. So an aligner should be worn for 2 weeks, and after 2 weeks the patient has to remove the aligner and place the next one.
Okay.
Understood? So depending upon the severity, say for 1 year there will be 24 aligners. So the patient should wear it for 2 weeks and then go on to the next, so that at the end of the year the malocclusion will be corrected and the desired result will be achieved.
No, that means the patient has to go every 2 weeks, or?
The patient has to use an aligner for 2 weeks. Okay. And after 2 weeks, the patient has to take the next set of eyeliner and place it.
Okay, so that you will be provided?
That everything will be providing.
Okay, right. Doctor, what is the ideal age for using this?
The ideal age, once the permanent teeth have erupted up to the second molar, we can do the treatment. Say it's like 13 to 14 years. Once the second molar is erupted completely, then we can go forward with the treatment.
How common it is in Kerala now, this procedure?
It's very common in Kerala and in India. The only company which provides aligners in India is a company called ClearPath. So this is a CAD-CAM aligner, which is a US company. So it's available in all leading clinics in India and in Kerala. So it's quite common among youngsters and also young adults. And NRI people, there are a lot of NRI people in Kerala, so it's common, it's a trend among them also.
Doctor, we have got a mail. Doctor, I am Praveen from Kollam. I want to know about tooth whitening.
Tooth whitening, yeah. So tooth whitening is basically called bleaching of teeth. Now it's a cosmetic procedure. So the thing is that everybody has a shade. Every one of us has a shade. We can bring 2 shades whiter. Understood? So there are different procedures in which we can do tooth whitening. The basic thing is that we have some packs commercially which is available. We could use it in our home itself. And then there is professional whitening, professional bleaching, in which sometimes LED is used, sometimes laser is used to whiten the teeth. So we could bring the shade much more whiter. So I would suggest that you should only do a professional whitening, because sometimes some mishaps might happen if you do it alone, sometimes maybe. And then sometimes in the patient should completely be aware of their oral condition before they go for whitening. In some patients where there is much wear and tear, there is a chance of the patient might have sensitivity once the whitening is done. So better go to a dentist and make out a treatment plan before do the procedure, so that it would be good for the patient.
So doctor, that is really an informative talk.
Yeah.
Thank you so much.
Thank you. Yeah.
So that's all for today. So friends, if you have any doubts, write to us. Our email ID is youthdiaryroseball@gmail.com. See you.